Welcome to the November 7th meeting of the Rotary Club of Jamestown. Please join me in reciting the Pledge of Allegiance, singing our national anthem, and repeating the four-way test. Let's repeat the four-way test. The things we think, say, or do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? Our invocation today is by Vince Horgan.
Thanks, John. For the gift of service. This week in November really is celebration of the month of service. Tomorrow, we all go to the polls and we elect public servants who truly, in many cases, give of themselves. We hope, Lord, that they do it for all the right reasons to make our community better. This Friday, we celebrate veterans, service to our nation, those who step forward to defend our freedom and our very way of life. And we thank the Lord for hospice and healthcare workers that serve our community. Lord, we ask that as Rotarians, you make service above self come alive in all of our hearts, that we truly work hard to make our community a better place. In your name we pray. Amen.
Thank you, Vince. Please welcome President-elect Ruth Lundeen to announce visiting Rotarians and guests.
Thank you, John. It's taken me this long to figure out I could use the second mic to make my announcements. So today, visiting again and a prospective new member is Emily Kama, who is Yoa's mom right now. So well, there she is. You changed tables.
Thank you, Ruth. Announcements. Ruth, got some?
So for announcements, first of all, we've been doing some new things, and so we are asking people's assistance. Those who sign up for the 50-50, selling the 50-50 tickets at the front table, we are asking that you please also add to your responsibilities making sure the badges are out. Okay, so if you would do that, make sure the badges are out when you get your 50-50 bucket. We would appreciate that. We are looking for someone and someones to help us at the end of the day, at the end of the meeting, to help collect up the last straggling badges, and then put the badge box back in its cabinet. So if you're interested in doing that, please let us know. But also this microphone, this second microphone that we use for going out into the group to make sure that all the questions and comments are heard by the people on Zoom. We would love to have this be a responsibility of someone in the room. So if you're interested in being the keeper of the second microphone, please see me. The other announcement I have is from Rudy and Alora. So the international students at JCC are having a big fair a week from tomorrow, November 15th. And they have asked for Rotary to have a table there to, first of all, to explain to the students what Rotary does internationally. And then also to talk to students who might be interested in being a part of the exchange. So we would love to have a couple people manning those tables. And the table would be like from 12:30 until 1. So during what they're calling the Go Global Student Fair. So if you're interested in helping out with that, we would certainly appreciate it. Especially if anyone from the exchange committee could be there to talk about how exchange works. I know it's too late for the long-term exchange, but it would be, people could do the short-term exchange. And they are hoping to have some high school students there. So please take one of these if you need one and they're not enough at your table. I have more of them. President John has been so kind as to say that you could use this for a makeup if you so chose.
Thank you, Ruth. Our Rotary yours recorder today is Walt Pickett. Many thanks to you and the Communications Committee. Somebody bought 50/50 tickets but forgot to take them with them. So I have them up here if you realize they're yours. November 21st, we're looking at having an off-site meeting somewhere. The social committee is working on it. We'll follow up with details. We'd have no noon meeting that day. We just have an after hours social event somewhere, location to be determined. We'll get that out to you guys as soon as we have a location picked out. December 5th is the JHS a cappella choir performance at First Lutheran Church. Probably start about 11:15 for lunch, and then their performance is at noon. So mark your calendars. We'll have a sign-up sheet next week. I'll get one and send out a sign-up online as well. So that's December 5th, and then December 12th is our annual meeting, and we need a quorum for that. So please mark your calendars to be here for the annual meeting as well. Any additional announcements, comments from committee chairs? Birthday table. Let's give a warm welcome to Sue Jones to help us celebrate our November birthdays.
It's a sparse month in November, so I corralled Diana to sit with me, and she celebrated last month. But today, we're going to talk about November is Foundation Month for Rotary International, and you'll have a lot of opportunities to show your support for the foundation, one of which is contributions for your birthday. In addition to celebrating with a gift on Giving Tuesday, which is November 29th, you can find ways to thank donors in our club or district. As we reflect on the good we've all done together, the foundation will be sending many thank you notes to our supporters who make all of our work possible. So just think if each one of us donated $5 to the Rotary Foundation, and I mean each one of us 1,300,000 members, what we could do with that. So if you are able, please forego a Tim Hortons coffee mocha ploca and send it in instead to the Rotary Foundation. And we missed Deborah Kathman's birthday on November 3rd. Debbie is retired executive director of the Striders, and she is a graduate of Mercyhurst College. Her father was a very long-term member here and gave her a Paul Harris Fellow in 2005, and she earned another one in 2019. And Deb and Deke are busy roaming the world, taking care of their many, many grandchildren. So wherever she is, I hope she has a good Thanksgiving. Melissa Myers, thank you for joining us today. You're the only one that showed up. November 22nd is Melissa's birthday. She is an owner artist of White Porch Studios, and she is a magnificent painter. If you have not had the opportunity to see her wonderful paintings, just ask her and she'll tell you where they're on display. It was a wonderful one of the lake that I think sold recently, but it was gorgeous. She attended JCC and Buff State College. She's a Paul Harris Sustaining Club member. She's a past president of the Olean Club. Am I right? Yes. She comes to us as a transfer from Olean Club, and she's the holder of 9 Paul Harris Fellows. We thank you for your generosity and wish you a very happy upcoming birthday. And Mike Roberts, I don't think he snuck in there, but his birthday is the next day, November 23rd. He is president of Allied Alarm Services Incorporated, attended Wright State University. He's been a longtime member of the Paul Harris Sustaining Club. He's a past president in 2001, and he has 3 Paul Harris Fellows, and he has his finger in just about every pie in Jamestown. And we wish Mike a very happy birthday as well. And today we're going to sing happy birthday to our pumpkins, okay? Happy birthday to you. Happy birthday. Happy birthday, dear pumpkins. Happy birthday to you. And the winner of the free lunch is Melissa Myers.
Thank you, Sue. Please get your tickets ready as we welcome Walt Pickett for today's 50-50 drawing.
$50-50 is $47. And I think we should have one of our guest speakers.
Four, 5, 3. Congratulations. Give a hand for our Sergeant at Arms, Doug Conroe.
Good afternoon. Good afternoon. Well, yes, because we need to fill it quickly, and there we go. We have Kurt and see, get this right there. Kurt has to leave early, as does John, so they've started it off. Again, as I look around the room, people I'm looking for are not here today. Bummer. So what are we going to do? Well, I'll think of something, I'm sure. Remember a couple weeks ago, I said, Melissa's trying to get the badges updated to correct classifications. And please do it. And if you don't, we'll recognize you up here. The time has come for the first recognition. I say first because how many members do we have in the club? Any idea? Almost 90. 50 of which have not responded to Melissa. Ooh, that's not good. So if you have not checked in with her about whether or not your badge is accurate, please kindly do so. And if you happen to be in the room, Russ Dietrich, Sharon Hamilton, Dewey Jones, Sue Jones, Lee Magnuson, Sally Martinez, you have not checked in, so the clock is due. Pay the piper, please. Thank you. I don't hear the pitter patter of feet. I don't hear the feet coming up here. So let's not read your name again. So come on up. Come on. I just read off a few names of people that I know are in the room. Okay. And then we talk every now and then about Rotary. Thank you, Lee. And I see Randy hiding behind cups and pillars, so I won't call on his table, but I see him. So where, if you've been looking at the magazine lately, where is the 2023 Rotary Convention going to be held? That's an easy one for your table, I'm sure. Yes, we're good. I see they're digging for the money. Okay. Melbourne, Australia. That tells me you didn't look at the front cover of your magazine when it arrived in the mail. So that's a great magazine. Let's take a look at it. And again, it's still football season. Greg Jones is getting by. He's dealing with the Syracuse. They're paused a bit. I think they're on rehab so that they can do better next year. But yeah, quarterback is recovering. But go blue, undefeated, Michigan. And Greg, though, honors his father for Pittsburgh and reminds us of longtime Rotarian Pat Morrell. So Greg is helping us out here for football for Pittsburgh. We have anybody else in the room from RPI, Hiram, Cortland, Notre Dame? We got to get Mike Moots back here. I think we have another Notre Dame person. Ohio State, we got to get Mike Roberts back here. Rochester, Allegheny, I think we have an Allegheny person. Walden Wallace, and I'm very certain we might have a Mount Union person or two. Ohio Northern, Brockport, and John Lloyd's not here for Penn State, but perhaps there are some other Penn State people. And that's what I have to offer for today. I'm sure the line will be long for Happy Bucks.
Thank you, Doug. So Happy Bucks, I'll get us started. I got, I missed. I got 5 to get us started here. First, we've talked a lot about badges today. That's because, well, Greg Jones and I had a hand to play in that. Yesterday when we were trying to clean up, we got the box and we said, how do you close this thing? So we flipped it over and they all fell out. And then we said, no, that's not right. So we flipped it over again and all the rest of them fell out. So as Greg and I are thumbling around trying to figure out how to put these back in alphabetical order, Stu said, just forget it, you guys. I'll just take them home and get it all sorted out. So many thanks to Sue Jones for cleaning up our mess. And they even put a label that said this side up. So much appreciate your service to Rotary there. A couple of Happy Bucks just for the weather. Beautiful weekend. Hope you guys didn't spend it like mine, just cleaning up leaves and yard work. But either way, it's better than in the snow. Kevin sent me an update on the pedal for polio. We've raised 1,300 so far for the polio challenge. There's a week left for donations. So thank you for all the peddlers and e-bike riders and Kevin for leading that charge. And then the district newsletter, Diana and the Literacy Club. The District 7090 posted the recording of the Basic Education and Literacy Web Talk, where our literacy committee was highlighted as an example for all the other clubs in the area. So that's something to be proud of. Thank you, Diana, and the Literacy Committee for all your hard work and recognition you received at the 7090 level. Any other Happy Bucks, please come on up. Anybody online? All right, well, thank you. It is my pleasure to welcome Becky Robbins from the Program Committee to introduce our speakers.
Joining us today to bring us up to date on our local Chautauqua Hospice and Palliative Care Organization. I'm not really sure about the full name. Are several members of its administration. And accompanying our speakers is Craig Garris Johnson, Director of Marketing and Communications. Put your hand up. He used to work at the BPU, so I can tease him. Our speakers include CEO Mike Testa, who joined the organization in July. He joined CHPC with more than 20 years of managerial and leadership experience in healthcare, business administration, and education. Mike and his family relocated to Chautauqua County, and they live in the Mayville area from Billings, Montana. He worked there at Riverstone Health for more than 9 years, the last 2 serving as vice president of the organization. Mike earned a bachelor's degree in organizational management from Ashford University and an MBA from Fitchburg State University. RN and clinical liaison Brooke Cusimano's role at hospice includes visits to doctor's offices and families across the county, promoting hospice and palliative care. A Jamestown native, Brooke has several years of experience working in pediatrics and is a licensed practical nursing instructor. She earned a Bachelor of Science in Nursing from Jamestown Community College and Damon College. I think Brooke's going first. Okay, thank you.
Craig's gonna get that so we can see it full screen. I did have a handout as well that accompanies this. If you did not get one, I'm sure if you raise a hand, Craig could just shoot you one over. You don't need it, or I can get it to you before you guys leave today. All right, guys. Well, thank you for having us and thank you for your time and attention. Again, we're here from Chautauqua Hospice and Palliative Care. Just to kind of give you an update on our organization and how we're serving our community and just kind of the impact that we've seen from some of the new things that have happened to us over the past year. So just a quick overview of what we're going to go through today, what services we offer, how to obtain our services, and just the impact that we're seeing on the community, as well as touching on the Star Hospice House, which is kind of like our big and new exciting adventure. So getting right into it, hospice versus palliative care is quite confusing and even can be confusing to some of our physicians. So it's a question that we answer frequently. And really just kind of knowing that palliative care is a broader spectrum and includes a broader spectrum of patient diagnoses, whereas hospice is a bit more specific. So we'll kind of go into what some of those differences includes for Chautauqua Hospice. So palliative care, and I'm not going to go through this entire chart, it's included in the handout. Palliative care is for someone that has a serious illness, and it can be for any stage of their disease and includes them having treatment. So that's kind of like what everyone thinks hospice does not include, that palliative care can still accept. So I've actually treated patients on palliative care who are awaiting biopsy results. So they truly don't even have an active diagnosis yet, and palliative care can help patients in those new and early stages of a diagnosis. Someone receiving palliative care services can also still be receiving any kind of treatment that they want or seeing any kind of specialist that they need for that diagnosis. So for example, someone who is going through chemotherapy or radiation, they have surgery plans, they're on dialysis, they can still receive all of that treatment within their diagnosis and have palliative care services. That's where that broader spectrum of patients and broader spectrum of criteria comes from. Whereas hospice is a bit more specific. It is designed for someone that has a 6 months left or less prognosis, whereas palliative care, again, there does not need to be a prognosis attached to their diagnosis. And hospice, they are no longer seeking curative treatments. They can still be taking a lot of different medications and receiving a lot of different therapies, but they wouldn't be receiving something that's considered curative. And again, that's like a chemotherapy, a radiation, a surgery, dialysis, things like that. But then commonly between the two, our goals are for symptom management and quality of life. This is just a little bit about the specifics of palliative care and what we can offer our patients. So there's a chart, and this is also in the handout, so you can view at a later time in more detail. It is insurance-based. So whereas hospice, all of the services are covered under the same insurance, palliative care and what we can offer you within that program is dependent on the insurance. But we do offer with Blue Cross Blue Shield, Independent Health or Univera, and private pay. So anybody can receive all of the palliative care services privately paid for under a sliding scale, which is financially based and takes financial compensation and income compensation in place. They get monthly registered nurse visits, 24-hour on-call services, and a doctor to prescribe and help manage those symptoms. So again, a good example is maybe someone who's newly diagnosed with cancer and going through chemotherapy and having some side effects from the treatment. That would be a great example of a patient who could receive palliative care services in their home to manage the symptoms from their disease, but also from the treatment that they're experiencing. On the other hand, we have a palliative care consult. That's something that you can think of as if you were to see any other specialist, maybe a GI consult or a cardiology consult, where your physician is getting the expertise from our physician on managing their symptoms, but the physician themselves, the primary care, is going to carry out those recommendations. Hospice services, which you may be a little more familiar with, they include a registered nurse, you get a social worker, a chaplain, again, that 24-hour on-call service, and the physician to prescribe for them. They also do get a home health aide. So everything we offer is within the home. And because it's within the home and we offer the services availability with 24 hours, a lot of what we do is help prevent emergency room visits for patients, as well as allowing patients to be homebound when they can no longer leave to see their primary care or specialist that they were previously seeing for treatments. We do offer a lot of additional services with hospice other than your traditional medical management. So you have your physician to help prescribe medications for you, your nurse, an aide, but we also believe in complementary therapies and what they do for people holistically. So we offer things like music enrichment, we offer massage therapy, we offer pet therapy, we have hairdressers that can come and do people's hair in the home without them having to leave. We do something really cool called life legacy writing, and we have someone that comes in and helps get their legacy down on paper for their families. And we also, upcoming is we have a maintenance person, possibly, hopefully, if everything goes through, where they can even do some odd end jobs around the home. So how do you receive hospice or palliative care? It's a big question that even the doctors ask us, is when is that right time to receive hospice care or palliative care services? And really what we want to encourage is that it's easy to get a hold of us and we're very easy to talk to. So whether that's having a conversation with us or having a conversation with your primary care, we can help decide if you're eligible for those services and which program might be best for you. So how to make a referral? You can just call us. So it's not something that you have to have your doctor initiate first. You can be the person to initiate a referral for yourself or for your loved ones. You can call and speak with our staff members. Tennille is our intake staff and she'd be happy to talk to anyone, as well as myself, with our numbers posted there and in the handout for your reference later. So you could call us, you could give us kind of a situation that you're thinking, hey, I think this person might be appropriate. What do I do now? It's okay to call us and not know what to do. That's the point of having us available for yourself. Or you can call your primary care or your specialist and they can help you decide whether the service is appropriate and get that referral over to us. And then I did want to just touch about our bereavement department, because we do serve the entire community. And I just want to make sure that it's well known, the services that we offer. So there are 3 ways that someone in Chautauqua County could utilize our bereavement services. The first is that their loved one was on hospice. So if the family member or friend had a loved one pass away on hospice, we offer 13 months post-death of bereavement services to be there for the family and the friends and help them through that journey. But the second way that we help Chautauqua County is our community support. So we offer bereavement services to anyone in Chautauqua County, whether that loved one was on hospice services or not. So you could have someone that had a loss and is struggling from that loss. If they were not on hospice services, they can still receive our bereavement specialties. We go into schools when there's been a difficult loss, possibly in the school. Or in the community. We actually went up to Buffalo a few times for some major losses that they were experiencing. So anyone that you know who could utilize bereavement services can do so, whether that person had any identification with hospice before that or not. And then we also have support groups. So whether support groups are your thing or sometimes it's really not somebody's thing, you can still utilize bereavement services. We have a generic bereavement group called Growing Anew. And we also have two specific kinds of grief counseling. We have the loss of a child. So anyone who's lost a child can utilize support from others who've also lost a child. And upcoming, so this is new, we're going to have a specific support group for people who have lost someone due to substance abuse, which I think we all know is something that this community could really benefit from. And if you're interested in any of the support groups, I do have schedules here with me today, so you can see when and where those grief support groups are located. So 3 ways that we're impacting our community through our bereavement services. And then the Star Hospice House. This is kind of our new and big exciting opening in July. So our community recognized that this was a big need because not everyone that deserved hospice services had the ability to receive those hospice services because of their home situation or lack of a caregiver. So the option at that point was either to be placed in a skilled nursing facility or possibly pass away at home without the proper care. So we now have officially open and full, as I think we are today, the Star Hospice House. It is a 5-bed unit, so we have the capacity to have 5 patients at a time. They're all private rooms, private bathrooms, walk-in showers. We do have a room for high flow oxygen, which has allowed us to receive a patient from the hospital where they wouldn't be able to go home on such high oxygen needs. They can be received into the hospice house, the Star Hospice home, and beautiful accommodations for the family. We have kitchens. Each of the couches pull out so the family can actually stay in the room with their loved one or in their own private bedroom. So we wanted to just bring a couple pictures for you guys to see. There's one of the bedrooms, the bathroom, and the family kitchen. And it's just really beautiful to see how it's been used, to see families cooking meals that were of importance to them in a facility like this, to have out-of-town guests come visit their loved ones in the last couple months of their life. And for me, working in the field previous to this, seeing where a patient might not have benefited from hospice services because they weren't eligible due to a lack of caregiver. Now knowing that they have the ability to pass away in something as beautiful as this and with the care that they deserve is just really special. So I even have a couple faces in mind of people who would have used this if it was available. So it's really special to us. There's just a couple more pictures, the family living room, the great room. We also have a music and art room with a piano, and it's just really beautiful and calming there. And so this is kind of how does hospice impact our community? So how do we evaluate ourselves and how do we evaluate the impact that we're having on our community? So these are just some good numbers to reflect that. So the national average of families who would recommend hospice services, so on a national level is 84%. And here in Chautauqua County, 94% of families would recommend another family or friend to Chautauqua Hospice Services. So we like to see that we're above the national average on someone recommending what we do. 29 is the additional days that a patient may live while in hospice care, according to studies. So whether that patient did or did not receive hospice services, we're actually seeing an increase in length of life than a decrease, which is one reason why people are choosing not to come to hospice is their fear to pass away earlier than if they were to not receive services at all. So we're kind of seeing the opposite, that patients are actually living longer with the services that we offer. $14,000 is the average hospice patient healthcare savings. So on average, they've saved money by coming to hospice and not going to the emergency room or having to utilize hospital stays and receiving that care and that specialized care in their home. And then 24/7 is our availability. And we all know that nobody gets sick Monday through Friday from 8:30 to 4:30. So that's not how we operate. We're available for our patients night, day, holidays, weekends. And just to see what our presence does is amazing. We have patients frantic or family members frantically calling us, and just to say, well, I'll be there in 10 minutes. And just the weight that's lifted off of their shoulders can be pretty immense. So I wanted to keep it brief to open up to questions, because I think it's just better to answer specifically the questions you have for us. But I just wanted to end with one. This is my favorite hospice quote, and it says, "The end of life deserves as much beauty, care, and respect as the beginning." And I had a baby about 1.5 years ago, which is nuts that he's that old. But I remember going through that as a hospice nurse and just feeling the impact and the love and the respect that I got from my family and my friends, and more importantly, the healthcare providers. And I came back to work after maternity leave, and I said, that's how I want to make my patients feel. I want to make them feel as good as the care that I got by having a baby, and that the end of life can really be just as beautiful as the beginning. And so that's just kind of how we feel everyone deserves that kind of care. So hopefully that was brief enough, but I wanted to get to the specifics of your questions. Fire away. Okay. Oh, I think we have a microphone being passed around.
One of the questions I had to ask is for home visits, if someone's in hospice care at home, how often does the nurse come? Because I know that you have an aide that's assigned to the patient, but does the nurse come every 24 or 48 hours?
So they do get a team. We believe in consistency. So as consistent as we can be, they are assigned a team. The team would be a registered nurse. It would be a HHA, a home health aide, a chaplain, a social worker, and the physician. The nurse comes at least once every 2 weeks if that's the bare minimum of their needs, but it's really tailored to how much the family and the patient has a need for. So in the last couple of days of someone's life, we might be there every day. Whereas if they have a little bit longer prognosis and the family feels more comfortable caring from them, they may be there once a week. So it really just depends on the acuity of the patient and the confidence that the caregiver has. But it is on call or as needed 24/7. So those are scheduled visits. So we're scheduled to come every week, or we're scheduled to come every other day. But if the family has a need, we come with that need. If that happens to be every day, then we send a nurse out there every day. So it's based on need. It doesn't have to be predetermined. We're not limited. We just at least have to have the eyes on the patient every 2 weeks.
I have a little experience. I was the vice president of marketing and development for a large hospice house and home services in Portland, Maine. And one of the things that when we would bring up the numbers, the administrative staff, that was really disheartening is when a patient was referred to hospice within 24 hours of their death. And so as the marketing person of that group, one of the things that we had to do with our liaisons is to really do a lot of education with physicians about how important it is to come on to hospice sooner rather than later. And so how are you doing with that education piece?
So I have a new role, and that's helpful. So we just developed the clinical liaison piece, and that's a big part of it. We want to see our length of stay increasing. We can do a lot more with 6 months than we can with 6 days. or 6 weeks of somebody's life. So when you qualify for hospice, it's qualified for a 6-month length of stay. That's where that terminal prognosis comes from. But that does not mean that at the end of that 6 months that someone is removed from hospice services. If the person still qualifies for hospice under the Medicare guidelines, they're reinstated for another 6-month period. That's how we have people on hospice for years. Is it the average? No, but it definitely is apparent that we're having people be appropriate for actually years to be on hospice services. Our length of stay, we want to get higher. And so what I'm doing now is I go into all the physicians' offices to provide education. We've developed something called quick criteria, and I've designed it specifically for each specialty. So I have a quick criteria for cardiology, I have a quick criteria for ER, where they can see this. If I start marking these boxes with my patient, they are appropriate for hospice. The other thing we've talked about our primary cares too is not to lean on a specialist, and for a specialist not to lean on a primary to refer, because I think that that's another issue with length of stay. Is a primary is deciding that the cardiologist is going to make that call, and the cardiologist is deciding that the primary is going to make that call, and then no one made the call. So just educating to kind of take that on for themselves with their patient. The other thing is we say when in doubt, refer. A referral that is not quite hospice appropriate is a great referral, because that means we've met that patient, they are comfortable with us, they've answered their questions, and then we're going to catch that patient with a 6-month prognosis and have them for a lot longer than if we couldn't. So that's how we're trying to increase our length of stay in our community, is just that constant education. Did that answer your question? Okay, good. It's tough. We've been doing this since August, so we've got a long way to go, but we're getting there. Yep.
Do other communities nationwide around the country have similar programs like this, or even close to it? Or is it unique, this outstanding program that we have in Chautauqua County? To me, sitting in this audience today makes me think it's very unique. But is this kind of a program available nationwide or even worldwide?
Yep. So hospice, Mike wants to answer this one.
So community-based hospice and palliative care services is not unique to our community. So like where I came from in Montana, we had a home health and hospice program there as well. What I will say is unique is the second part of what you said about hospice programs is the quality of care that we provide here. So we're seeing an influx of for-profit hospice services that are popping up around the country, and they're there to make a buck. And a lot of times what we're seeing is they come into a new market that doesn't have a certificate of need, which is a state regulation that governs how many hospices can be in a certain area. So we only have one hospice here in Chautauqua County because of the state certificate of need. Other states like Montana got rid of it. For-profits are moving in. They're raking in as much money as they can. Then their quality numbers come back poorly, and then they close shop and find another community. And here's what's illustrative of how great CHPC is. We just had a HIPCANES conference last week, which is the Hospice and Palliative Care of New York State. And so all of the member organizations went to Albany. We had 2 days of conference. And during that, they talked about the STAR rating, which is CMS's way of communicating how much quality an organization has. So if you have somebody, a loved one that needs hospice services, how do I know which organization to pick or whether they offer quality services? And they do it on a 5-star rating. And HIPCANES, out of all of their member organizations throughout the state of New York, there are 4 organizations in all of New York that has a 5-star rating with a 5-star rating through CMS, and CHPC is one of those 4. So I just had to do a little bragging on that. This is an awesome organization. I'm proud to be a part of.
Yeah, I just had a quick question about inpatient and outpatient work.
Yep.
Obviously, everybody that needs hospice or is involved is not part of your inpatient facility. So how many people are you reaching with outpatient in Chautauqua? Is that a big number?
So we actually can do inpatient and outpatient. So the Star Hospice House is a specific designed inpatient setting for someone with a 3 less 3-month or less prognosis, but we can be involved with anyone that is in a skilled nursing facility, and we are. So if somebody is in a skilled nursing facility in Chautauqua County, not only are they receiving obviously the 24-hour attention of that skilled facility, but they can still receive hospice services and all our hospice services. So they still can have an additional at 1 hour a day, 5 days a week of aid service. They still have the nurses come in. Their staff can utilize our staff 24 hours, which they've been very appreciative, especially through COVID. So we don't do inpatient as far as in a hospital, although we do consults. Dr. Putnam goes in and gives his expertise when the doctors are requesting them. And I've actually just last week went to Westfield and UPMC here to sit down with a patient and do a consult, evaluate them to see if they were appropriate for those services, and educate the family on how they can receive those services, whether that be at home, at the hospice house, or in a facility. So the only place that we're not is in an assisted living facility. Otherwise, we can be inpatient as well. Yep. I've got a microphone over here, but yes.
Sometimes after a loved one, friend passes, part of the grieving process, some people say, I wish I had been able to do more. Others say, I'm glad you took care of it for me. But do you have something that people can ask for help, teaching them how to be part of the care?
Yeah, so we are not 24-hour nursing services in the home. So we rely on our caregivers, and that is a huge educational piece for our nurses, is to give that caregiver, whether it be a spouse or a daughter or a son, the education to take care of that person. So really, a lot of times we are caring for the caregiver more than we're actually caring for the patient, because we're giving that education and we're stepping away. A big part of giving that caregiver confidence is that I can do it, but if I can't, I can call. So knowing that I can do this, and if I have a question, I can call, someone's going to answer, and if need be, they can come here. So I think it gives them actually the ability to care for their loved ones a little more, because they have that boost of confidence to try. And if I fail, it's okay, because I have this great safety net that I can call. We also leave a lot of material in the home, and one of them is this beautiful book called When the Time Comes, and that's given to the caregivers as like a sneak peek of what you're going to see, and not letting anything be a surprise, so that they can anticipate what they're going to see and know how they're going to handle that. So the education we're giving isn't this is what you're seeing and this is what we're going to do. It's this is what you're going to see, and this is what we already have in place. So just kind of anticipating their needs, I think, says a lot too. And then the bereavement services after, we hold tight to our families. We see them a lot afterwards too, and just kind of saying, well, how are you doing now? I think is impactful.
This is Joanna Dahlbeck.
We
Hello.
have a couple. So our medical director is Dr. Thomas Putnam. He's been in the community for a long time. He's from the Kennedy area. He used to work at the Resource Center. A lot of people know him from that. We have a palliative care nurse practitioner, Heather Mandel. We have another hospice physician, which is Dr. Mitchell, Michael Mitchell. And then we have a couple nurse practitioners that kind of do per diem and help us with some face-to-faces. But the primary hospice physicians are Dr. Mitchell and Dr. Putnam.
One of the questions I have is around billing. So if someone has hospice care in a nursing home, is the patient, how does that work with as far as billing goes? Or do they have to give up their bed and privately pay that? Or because that sometimes is a myth with families, that they may have to hold that bed by private paying it if they go on hospice services.
So not in a skilled nursing facility. They can receive hospice services through their Medicare benefit the same they would as home in a skilled nursing facility. The only billing issue that there is if they're in an assisted living facility, but in a skilled nursing facility, no, it's covered just as a home setting. Yep. Anything else?
Hello. Hello.
Thank you for that wonderful presentation. Thanks for all the work you do in the community. One of Rotary's major international programs is to eradicate polio in the world. In honor and thanks for your presentation to our Rotary Club today, we'll make a donation in your name that will vaccinate 4 children who will never experience polio in their life. Remember this year's Rotary International theme, Imagine Rotary. Thank you, and we are adjourned.